Dumping syndrome after bariatric surgery can be good and bad. Hi, I'm Steve Kelly, Bariatric Surgeon from Christchurch, New Zealand. Today I'm going to talk about dumping syndrome after bariatric surgery. Dumping syndrome is where food is rapidly dumped into the bowel, and this causes unwanted symptoms. It occurs in all patients after gastric bypass and in about a third of patients after sleeve gastrectomy. The positive effect of this syndrome is that it keeps people away from sugary or fatty foods, and it does this by creating an aversion to these foods. In early dumping, if fat or refined sugars are eaten, then approximately 20 minutes later, a chemical reaction occurs in the bowel, which causes the symptoms of nausea, cramping, abdominal pain, and diarrhea. These symptoms are not serious, but they do feel awful. Fortunately, they will soon resolve. Late dumping symptoms occur 2 hours after eating and are due to a low blood glucose level. Food causes a spike in blood sugar, which then creates a spike in the hormone insulin. The spike in insulin lowers the blood sugar, and this causes the symptoms of late dumping. And these symptoms are sweating, nausea, racing heart, lightheadedness, or shaking. The symptoms will quickly resolve by eating some food with carbohydrates, and this is because it raises the glucose levels back to normal. The treatment for dumping syndrome is mainly dietary, so it is important to make contact with your bariatric dietitian to discuss this. The recommendations are eating more protein, fiber, and healthy fats. What this will do is slow digestion and reduce glucose spikes. Avoiding refined sugary foods like lollies, chocolate, biscuits, or sugary drinks is also very important. Avoiding milk or milk products. This is because the sugar in milk, called lactose, also causes dumping. To fix this, you can either reduce lactose consumption or use lactose-free dairy products. Withholding liquids 30 minutes after eating reduces the washing effect of food into the bowel, and this also reduces the glucose spike. For 1% of patients, symptoms can be severe, in which case we then will use medications such as Archibose or somatostatin injections.